First and foremost, we are dealing with a national emergency, and the President of the United States must understand that and declare that emergency. Next, because President Trump is unwilling and unable to lead selflessly, we must immediately convene an emergency bipartisan authority of experts to support and direct a response that is comprehensive, compassionate, and based first and foremost on science and fact. In other words, Congress, in a bipartisan manner, must take responsibility for addressing this unparalleled crisis. Further, we must aggressively make certain that the public sector and the private sector are strongly cooperating with each other, and we need national and state hotlines staffed with well-trained people who have the best information available. One of the aspects of the current crisis is there are people who are asking themselves, what are the symptoms of coronavirus? Do I have a cold? Do I have the flu? Do I have the coronavirus? Who's going to help me? Where do I go to seek medical treatment? How do I get a test? When is that test going to be processed? People have a lot of questions, and at the statewide and federal level, we need experts to provide the necessary information to our people. The American people deserve transparency, something that the current administration has fought day after day to stifle. In other words, we need to know what is happening right now in our country, in our states, and in fact, all over the world. If there was ever a time for transparency and honesty and being straightforward, this is that moment. And we need that information coming from credible, respected, scientific voices, of which we have many in our own country and all over this world, not from politicians. And during a crisis, we must make sure that we care for the communities most vulnerable to the health and economic pain that is coming. Those in nursing homes and rehabilitation facilities, those confined in immigration detention centers, those who are currently incarcerated and in jails, and all people regardless of their immigration status. Unfortunately, as I think the American people increasingly understand, our country is at a severe disadvantage compared to every other major country on earth because we do not guarantee health care to all people as a right. And as we speak, some 87 million Americans are either uninsured or underinsured. And when you are uninsured or underinsured, you hesitate about getting the medical care you need because you cannot afford to get that medical care. The result is that millions of our people cannot afford to go to a doctor, let alone pay for a coronavirus test. So, while we work to pass a Medicare for all single-payer system, the United States government today must make it clear that in the midst of this emergency, everyone in our country, regardless of income or where they live, must be able to get all of the health care they need without cost. Obviously, when a vaccine or other effective treatment is developed, it must be free of charge. We cannot live in a nation where if you have the money, you get the treatment you need to survive, but if you're working class or poor, you get to the end of the line. That would be morally unacceptable. Further, we need emergency funding right now for paid family and medical leave. Anyone who is sick should be able to stay home during this emergency and receive their paycheck. What we do not want to see is at a time when half of our people are living paycheck to paycheck, when they need to go to work in order to take care of their family. We do not want to see people going to work who are sick and who can spread the coronavirus. We also need an immediate expansion of community health centers in this country so that every American will have access to a nearby healthcare facility. Where do I go? How do I get a test? How do I get the results of that test? Need greatly to expand our primary healthcare capabilities in this country, and that includes expanding community health centers. We need to determine the status of our testing and processing for the coronavirus. The government must respond aggressively to make certain that we, in fact, have the latest and most effective tests available and the quickest means of processing those tests. There are other countries around the world who are doing better than we are in that regard. We should be learning from them. None of the medical experts that I have talked to dispute that there is a major shortage of ICU units and ventilators that are needed to respond to this crisis. The federal government must work aggressively with the private sector to make sure that this equipment is available to hospitals and the rest of the medical community. Our current healthcare system does not have the doctors and nurses we currently need. We are understaffed. During this crisis, we need to mobilize medical residents, retired medical professionals, and other medical personnel to help us deal with this crisis. We need to make sure that doctors, nurses, and medical professionals have the instructions and personal protective equipment that they need. This is not only because we care about the well-being of medical professionals, but if they go down, then our capability to respond to this crisis is significantly diminished. The pharmaceutical industry must be told in no uncertain terms that the medicines that they manufacture for this crisis will be sold at cost. This is not the time for price gouging or profiteering. The coronavirus is already causing a global economic meltdown, which is impacting people throughout the world and in our own country. And it is especially dangerous for low-income and working-class families, people who today, before the crisis, are struggling economically. Instead of providing more tax breaks to the top 1% and large corporations, we need to provide economic assistance to the elderly, and I worry very much about elderly people in this country today, many of whom are isolated, many of whom do not have a lot of money. We need to worry about those who are already sick. We need to worry about working families with children, people with disabilities, the homeless, and all those who are vulnerable. We need to provide, in that context, emergency unemployment assistance to anyone in this country who loses their job through no fault of their own. Right now, 23% of those who are eligible to receive unemployment compensation do not receive it. Under our proposal, everyone who loses a job must qualify for unemployment compensation at least 100% of their prior salary, with a cap of $1,150 a week or $60,000 a year. In addition, those who depend on tips, and the restaurant industry is suffering very much from the meltdown, those who depend on tips, gig workers, domestic workers, and independent contractors must also qualify for unemployment insurance to make up for the income that they lose during this crisis. We need to make sure that the elderly, people with disabilities, and families with children have access to nutritious food. That means expanding the Meals on Wheels program, It means expanding the school lunch program and SNAP so that no one goes hungry during this crisis, and everyone who cannot leave their home can receive nutritious meals delivered directly to where they live. We need also, in this economic crisis, to place an immediate moratorium on evictions, on foreclosures, and on utility shutoffs, so that no one loses their home during this crisis, and that everyone has access to clean water, electricity, heat, and air conditioning. We need to construct emergency homeless shelters to make sure that the homeless, survivors of domestic violence, and college students quarantined off campus are able to receive the shelter, the health care, and the nutrition they need. We need to provide emergency lending to small and medium-sized businesses to cover payroll, new construction of manufacturing facilities, and production of emergency supplies such as masks and ventilators, a very serious problem right now in the midst of this crisis. Here is the bottom line, and that bottom line is that in the midst of this unprecedented moment, we need to listen to the scientists, to the researchers, to the medical folks, not to politicians. We need an emergency response to the current emergency, and we need it immediately. We need more doctors and nurses in underserved areas. We need to make sure that workers who lose their jobs in this crisis receive the unemployment assistance they need. And in this moment, we need to make sure that in the future, after this crisis is behind us, we build a healthcare system that makes sure that every person in this country is guaranteed the health care that they need. Thank you all very much.
That was Senator Bernie Sanders, Democrat of Vermont, independent of Vermont, running for president in the Democratic Party. Will obviously given a very detailed speech of his analysis of the coronavirus situation, again, following President Trump last night, following Joe Biden earlier this afternoon. Frankly, I thought it was a very, very in-depth speech with a lot of ideas that have not been broached by either Vice President Biden or President Trump. And this, folks, really is why, as I tweeted out earlier today, is why I think Bernie Sanders' message and plans is ideal for this unfortunate, tragic moment which we face in the United States and across the planet. He is somebody who has a plan, and much like 1932 with Franklin Delano Roosevelt, his hero, who we should continue to talk about, which I have said over and over again, that time in 1932 with the Depression going on, Roosevelt called for quick action. And that is all of the issues that I think are really important for us. We are, again, I think, important for us to take a real look at this. We are going to talk to Mr. Kevin Kavanaugh and, again, Christine Pontus at the bottom of the hour. And we are going to focus over the next few minutes with your phone calls. Now, folks, I want to make, again, we're going to talk to Mr. Kavanaugh and Ms. Pontus together at about 3:34 today, and we'll do that, after we take your calls. Folks, I think it is really important that we understand the concerns that many people are having right now, and why we are spending time in the beginning of this show to be able to sort of allay fears, to elevate what everyone can do. As you mentioned, Senator Sanders, had talked about that we need to take care of each other. Not to get in each other's way or to, catch the disease by doing too much. But I think that it's important that we don't look at this as, well, I'm okay, as Senator Sanders said, and everybody else is screwed. So I think that it is extremely important, for people to just take a deep breath here. I know myself that in my family, we're going to try to do what we can to not only help neighbors, but to be able to sort of, take care of ourselves as a family. But I think it's important that everyone understands that what they can do, being safe, of course, is something that we need to consider. Because, again, as Senator Sanders and I think Vice President Biden said earlier, is that we need to get through this together. And I think that is, a big part of where we are. I also believe that it is an important piece of the puzzle, and one in which, to me, is really critical to the nation, that we understand that our leaders have to lead, and if it's not going to be from the President of the United States, although I will say this, over the last couple of weeks, I think that giving Mr. Fauci, the head of the NHF, and the CDC is working hand in hand to lead, and they're much better than they were 2 months ago, where they were, weren't even telling us the true story of what was happening. This was COVID-19, as in 2019. So we've been blinded by this. I think it is really important that we work together as a team, whether it's the federal government working with state governments, Congress. I think all of this together is a really important moment. And, as people have talked about, and again, using Roosevelt as an example, you have nothing to fear but fear itself. That is a good line and a good theme to continue this discussion as we move forward. But I think it's also important. That people understand that there is indeed a focus, and one in which the American people understand that, that they can be helpful. They don't just have to be victims. They don't just have to stay at home and look at the walls. Unfortunately, a lot of the entertainment, whether it's sports events, have been canceled. Baseball announced today, NHL hockey. Again, we'll talk to former NHL coach and general manager Doug McLean coming up at about 4:30. We want to hear from you. The phone number to join us is 844-713-3459. 844-713-3459. We have a few more minutes till the bottom of the hour, and then we'll talk to both Dr. Kavanaugh and Christine Pontus of the Mass Nurses Association, and get a perspective here on what it is that has to be done, where the future lies. A lot of information that is being told to us about, everything will be great in the summertime, may not necessarily be the case. So I think it is extremely important. Again, Mr. Kavanaugh is board chairman of Health Watch USA, and we'll be talking with him and Ms. Pontus at around 3:34 Eastern Time. Again, I want to open up the phone lines at 844-713-3459. As many of you who listened to me yesterday felt that Senator Sanders had to come out and talk about these issues and actually talk about ways in which he connects with seniors. He mentioned it today in his speech. The senior citizens of this country and the voters who are 65 and older have not voted for Bernie Sanders. He needs to make a very big approach to them, and we'll see in the debate if he connects on Social Security, which, of course, he has been really the guardian of Social Security as FDR promised it in the 1930s, and Joe Biden has been willing, basically, to privatize it, to put it on the chopping block, potentially. So as Social Security as we know it today. This is something that has to be discussed. You have two important primaries in two states, as Florida and Arizona, which have large senior citizen populations. So I think that's an important thing. One of the reasons why I felt it was important for him to go this week to FDR's home in Hyde Park, New York, to do a speech. Maybe he still will. But I think these are all issues that where politics and, day-to-day life are combining right now. Again, I don't have any desire here to sort of split this amongst Democrat and Republican lanes. People are sick, they're sick. They're not Democrats who are sick or Republicans who are sick or independents or Greens or whatever. We need to protect everyone, every American, everybody that is around the world. It's the responsibility of individual governments to protect their individual citizens. But we shouldn't be demonizing people from China or Italy, as seemingly has come out of the White House over the last month or so. So these are things that have to be done, and we got to work together. Look, there may be a vaccine by a Chinese scientist or a Italian scientist. We don't know that. So let's work with folks, hand in hand. Wear gloves, but hand in hand, to be able to do this. And I think that is a important piece, again, of the puzzle. It is no time to sort of, blame somebody or some country. It is no time, in my view, to be able to focus, unfortunately Donald Trump has been, on, saying, well, I did this, and if it wasn't for me doing this, we would be in much problematic shape and so forth. We can't afford to have that sort of, taking advantage of the situation for your own political perspectives. Look, we all know that Donald Trump wants to win the election in November, as do Sanders and Biden. But the fact is that you're not going to win it by lying to the American people. Yes, we have great professionals here, as mentioned in that last night, and again this morning did Donald Trump. But the problem is that so do a lot of other countries. And if you diss other countries, that's going to make it harder when, again, if they find the vaccine in other parts of the world, that if you're continuously giving them the middle finger, well, that is a less likely scenario. I mean, obviously, they're not going to say you Americans can't have it because your president is, trashing me or trashing us in our country. But it is not a very good way to behave because we're all part of the planet. And again, I think this is one of the reasons why Donald Trump, in my opinion, is lacking in this empathy for people, and not only Americans, but people around the world. And I think that is a really important piece of the puzzle. All right, as I said, we're going to come back. We're going to talk to Dr. Kavanaugh, and we'll be joined also at the same time by Christine Pontus, who we heard from yesterday at the Massachusetts Nurses Association, and get a deeper perspective of what we are facing. It's the Jeff Santos Show, back in a flash.
Supporting the middle class. This is the Jeff Santos Show.
"33 minutes past the hour. It is indeed the Jeff Santos Show. You're tuned into. We're here every Monday through Friday, 3 to 6 Eastern Time, 12 to 3 Pacific. And of course, like most of the media today, we are focused on the coronavirus, and we'll be focusing the entire 3 hours in some form or shape about how to deal with this on the economic side, on the healthcare side, and how it relates to things that we like to do in terms of watching sports or movies or entertainment of any sort. A lot of it being canceled today from last night, the NBA, the NHL today suspended, and of course Major League Baseball. Again, we'll talk with former NHL general manager and coach Doug McClain at about 4:30. But we start this first segment with a discussion with two doctors, two, I should say, medical professionals. One, the former surgeon and now board chairman of Health Watch USA, Dr. Kevin Kavanaugh, and, of course, our good friend. We talked yesterday at the Mass Nurses Association, their coronavirus specialist and spokesperson, Miss Christine Pontus. Welcome, both of you, to the show, and thank you for joining us.
Good morning, sir.
It's great to have you both, and a great welcome, Dr. Kavanaugh, if that's okay. I like to call you Doctor. If you can start us off, is, in your mind, the information that is coming out through mainstream media and other resources and from the federal government, is it up to date, and is it the best information that we could have, or where do you think we should be right now?
Well, I think we're far behind on the testing. There's no question about that. And without having accurate numbers, it's very hard to know what strategies to put in place. I think most people are now assuming the virus is fairly widespread in the communities. And so we now really have to rely on social distancing. And that's a strategy which is attempting to what we call flatten the curve, to spread out the epidemic, to delay those that get infected so we do not overwhelm the healthcare system.
So, and I know we had a chance to talk earlier off air, Dr. Kavanaugh. So, when again you talk about flattening the curve, the idea of keeping people away from major gatherings, meaning baseball stadiums, football and basketball, and whatever rock concert, when your people are very close. And I think you had talked about the idea of staying 6 feet apart. Talk to us a little bit about that process and how that will help save people from being sick, save lives.
Yeah, it's just critical. 6 feet is the magic number which we're being told. That's kind of the distance that droplets can spread if someone coughs or sneezes. So you definitely don't want to get closer than 3 feet. If someone you suspect is infected, I would stay as far away from them as possible. And of course, if you're high risk, having a health problem, being over the age of 60, you should avoid crowds and public gatherings altogether. Stay at home as much as possible until at least the peak of the epidemic has passed. And it is absolutely crucial to do that, because what we don't need to do is to flood our healthcare system. If you notice, there's very different death rates that are coming out of countries. Some countries, the death rates are being quoted as being less than 1%. Others, such as Italy, is around 6%. And the large difference in that is whether or not their healthcare system becomes overrun with patients. And when that happens, supportive care can't be given, and the death rates will tend to go up.
We're talking with Dr. Kevin Kavanaugh, again, board chairman, here on the Jeff Santos Show of Health Watch USA, and Christine Pontus. Christine, let me bring you in here for a second. You know, when you look at you know, how M&A is handling this here in Massachusetts. Of course, Dr. Kavanaugh is not in the state, in the Commonwealth. Is Massachusetts you know, better off than other states, or how? You know, there's obviously a lot of medical professionals in Massachusetts. We all know about that. How are we doing locally here in comparison to the rest of the states?
Well, I'll just speak to the timeliness of Governor Baker just declaring an executive order for a state of emergency to respond to it. So, you know, based on what the governor has done, I'd say that we are in a, you know, considered to be in a state of emergency because of shortage of supplies and possibly the shortage of staff. And we at M&A are asking that there be no staff reductions, that they, you know, we're looking for staff increase as always and for training. We also want to make sure that there's enough personal protective equipment because our frontline caretakers need to be protected. So we're advocating that they have the N95 and of course the gloves and the aprons when they're taking care of COV positive and presumptive positive patients. Also to put them in negative pressure rooms, and Dr. Kavanaugh can speak with that also, because of the science of the aerosol when someone is in fact infected with it. So they need to be in at least a separate room with the door shut and most preferably a negative pressure. People presenting to hospitals need to be triaged so that they're not coming in if they can be home. So that's the biggest thing, and maybe Dr. Kavanaugh can speak to that also, is if we can keep people out of the hospitals that don't need to be there and become, they can, take care of themselves and their family at home, that will help to not overload the healthcare system. Did you want to speak to that,
Dr. Kavanaugh? Go right ahead, please.
Yeah, supplies are absolutely critical. There are many, many hospitals reporting short supplies. And one of the problems that we've had with our healthcare system is that it's really run on a shoestring, very lean staffing, very lean supplies, and it does not respond well when you have a huge increase in demand. And that's what we're facing. For those of you who are trying to wear masks or who are hoarding masks and you're in the general public, this is probably going to give you a false sense of security, because unless you have an eye shield and full hazmat gear, that mask isn't going to do you much. If someone coughs in your face, you're going to get it in your eyes, and then how do you get the contaminated mask off? And of course, you should only be using it a single time. So don't hoard the PPE or the personal protective equipment. Let the professionals have that so they can treat the patients. Very, very important. Your best way of preventing to get this virus is to avoid crowds, social distancing, which is 6 feet or more. If you're high risk for now, stay at home until things have passed. And this is very important, wash your hands as many times as you can. Soap and water is best, at least 20 seconds. If you do not have soap and water, you can use an alcohol-based hand sanitizer with at least 60% alcohol. These are all very important steps that people should be taking. But if you think you can put a mask on and then go to a rock concert and you're going to be fine, probably not, because if someone coughs or sneezes in your face, you don't have proper PPE on, and you're probably going to get the disease. So the key here is social distancing, and we've got to flatten the curve. We don't want to overrun our healthcare system.
We're talking with, again, the board chairman of Health Watch USA. He is a former surgeon, Dr. Kevin Kavanaugh, and, of course, our good friend Christine Pontus from the Massachusetts Nurses Association, the sponsor of the Jeff Santos Show, and right here in the Commonwealth of Massachusetts we broadcast from today. I have a lot of questions. Bernie Sanders just spoke. And he mentioned something that I haven't heard from either Vice President Biden or President Trump, and that is activating a lot of retired doctors and nurses, health professionals, probably a better term. Would this be something that you would recommend, Dr. Kavanaugh, if we are running a shortage?
Yeah. Definitely. There are a number of steps that could be taken. The National Guard, making sure that they're able to do this, reactivating either retired nurses or nurses that have left the profession. A large number of nurses have left the profession within 1 or 2 years of graduation of their college because they do not like working conditions. These are talented people in the community that could possibly be reactivated to volunteer their time and to come in. And so the nursing boards need to have a temporary way of reissuing licenses in a very expedient manner to get them staffing. What we do not want is where you have healthcare workers that have been exposed to the virus, in other words, close contact with someone that has it and that doesn't have PPE, that is now still seeing patients and will be seeing patients up until they get sick. That shouldn't be happening. Steps by closing down non-needed services such as elective surgery or elective types of treatments can be used to shift staff, and there may even need to be pooling of staff on a statewide basis where you have a hospital that, although they're not treating a lot of patients, are doing elective surgeries or elective services that they could curtail and possibly pool those staff into the hospital that is servicing these patients. And so all of these steps are things that could be considered, and certainly we need to start thinking out of the box so we do not get in a situation where we're similar to Italy, where we have numerous patients that are getting suboptimal care and they're having to triage who they should and should not treat. And that's not on the basis of who survives or who wouldn't, but they are getting into a situation now, from what I'm hearing, of not having enough services to offering this to every patient that needs them.
And we're talking with the board chairman of Health Watch USA, Dr. Kevin Kavanaugh, and a good friend from the Mass Nurses Association, not only a sponsor of the program, but a great labor union here in Massachusetts, the Massachusetts Nurses Association, Christine Pontus. Christine, to the point about adding nurses, retired nurses, how does that flow in? And is the scenario where you're understaffed, and maybe some urban hospitals, I think of the Boston Medical Center, or some of these places that are now closing, certain sections. People will still have babies delivered in this time, and I know here in southeastern Massachusetts, they were closed at Morton and so forth. So there are going to be people who are dealing with the coronavirus, but there are also people who are dealing with normal scenarios that are life and death, a traffic accident, and, again, somebody delivering a baby. Would that be helpful, and how do you coordinate that?
I'll be honest with you. Retired nurses, I think it's an individual decision whether someone feels physically strong enough and comfortable or trained up enough. If there was something some pathway or some way they could come and feel like they can get trained up or practice to a certain level, reestablish their license if they've let it go, it could work. But I think when Kevin spoke about the nurses who left, we have plenty of nurses who have left the bedside because of the working conditions.
Right. And
if there was some way we could bring them back in so that they would be working comfortably. Of course, we'd have to ensure the right PPE, and then also the testing. Maybe Kevin can speak to this also. I know M&A is certainly supporting and wanting more testing done, so that if people who have been exposed to patients can be tested, the patients can be tested, and that would add to a level of treating, becoming a healthcare worker if you're bringing them in and treating your patients with a little more comfort, and available know-how, knowing who you're dealing with. If, for example, that's the main concern right now. We just don't know among the patient population who may become positive. Does that make sense of some of the concerns?
Yeah. And the availability of tests is key. You need to be able to test patients to know if you've been exposed or not. Now, one of the things I disagreed with the news media with President Trump was that when he said, no, I don't want to take a test, he's not having any symptoms. There's no evidence right now on the false positives or negative rates of a test, or how reliable that test is in a person that doesn't have symptoms. They may not have enough viral genome that they're shedding to be picked up by a test. So it could be what's called a false negative, where you assume, they're clear, but in reality they're not. So I think we have to be very careful. And that's one of the problems that we have by approaching this so late, is that we don't have the information we need to make the proper decisions or the proper calls. All you can do is guess. I mean, I don't know whether or not people can spread this infection after they've recovered and for how many weeks, or do they spread it before if they're asymptomatic? They've picked up some viral markers, but do they actually spread the infection? We really need more studies, more data, and this is why jumping on this early when we had the chance was so important, and unfortunately we missed that opportunity. Personally, I agree in the initial travel bans. That helped to flatten the curve. It helped to buy us time. But in my opinion, that time was largely squandered. We spun our wheels. We didn't do our PPE stocking. We didn't do the test development or clearing people to do tests. And right now we are doing far too many tests to know how many people are infected with this virus. And we have right now too little knowledge regarding the reliability of the test if you're not showing symptoms. So we've got a lot of data and a lot of knowledge we have to gain, And unfortunately, we had a lot of time to gain this, and we just have missed the boat.
Again, we're talking with the board chairman of Health Watch USA, Dr. Kevin Kavanaugh, and Christine Pontus of the Mass Nurses Association. Christine, did you want to add something there?
Well, I agree with Kevin. There is a window of opportunity that we have missed, but we also have opportunity to make sure the situation doesn't become worse. And I certainly agree with him that we have to practice precaution. And I'm glad he spoke to the area I was saying that we need to know more. Absolutely. So to bring people in, we have to make sure the science is there. And I will say I don't think that we've supported our science long enough and hard enough. We've kind of discounted them for a while, and I think we need to reset our value system as to who we're going to listen to and what direction we're going to take. Once again, our healthcare facilities don't have the personal protective equipment. That is a concern for our frontline workers here. And
where can you get that, Christine? Where does that come from? CDC, federal government? Do we have to? Does the state have to ask for it? How do you get that protective gear?
Well, right now it's manufactured. So there are companies that actually, have manufacturing facilities that produce it. So they're short. So they certainly are producing or trying to manufacture it as we speak. But there are stockpiles. Kevin, do you know? But I think some of the national stockpiles were released in some. Am I correct with that? In other words, the government does have. Yeah. Go ahead.
But there's also some questions regarding whether or not they're out of date. And unfortunately, similar to drugs and medications, when you talk about antiviral drugs and medications, most of the precursors are made in China. The same is true for the PPE. And China's manufacturing has been severely hampered. So our supply chain has been threatened. We have decreased supplies. We have lean staffing. And believe me, this problem has existed for years. If you talk about other infectious diseases such as MRSA control, et cetera, our group has been advocating for more supplies, more beefed up surveillance and testing. So this isn't a problem that just arose. We are now going to suffer the consequences of a chronic problem that hasn't been addressed in our healthcare system. And when we talk about addressing all of these problems and plugging all the holes, everybody needs to remember there's about 10% of our population that has no access to the healthcare system. They may not be getting tests. They can easily be spreading the virus. And God help us all, because we all swim in the same fishbowl. The bottom line is that social change and pressure for social change shouldn't be done through the healthcare system. That's not what should be leveraged, because we all need to stay healthy, because we all live together in the same fishbowl. So that's, I think, another take-home message from this epidemic that we're having.
Would you agree, though, if I could add one thing, and I want to have both of you comment on this, as both a supporter of Senator Sanders of the Medicare for All, which is similar to many systems, whether it's in Canada, the UK, or France, would we be better off? My belief is yes, but I want to hear from you. If we had a system like that already in place, I would think that preparation and other things would be a major focus if it wasn't this sort of hodgepodge of things where we're asking insurance companies to come in and reduce some of the they're gonna basically not have the surprise billing and some co-pays but not others. They're going to do some things but not screen tests. I'm just wondering if that would be, and I'll go to you first, Christine, on this, because that would make, I think, your lives a lot easier.
Well, I mean, I have to reiterate that after years of closures of hospital beds and units, that the reductions in our frontline healthcare staff in hospitals right now have put us exactly what Kevin's saying. More of a crisis. So, and to your point about the hospitals with maternity, for example, we know that the hospital has been closing down maternity spaces and places for people to have children, have babies. So this is a real situation that's been going on, once again, for years and has led to this crisis because we've got this outbreak now and we don't have the community hospitals and the numbers that we had even 5 years ago. And with this highly contagious virus, there's just not even the amount of healthcare workers out there ready to go into the workforce. So all to what we've been speaking of, it's very real. And don't want to seem negative or overreactive, but we do need to understand that the general public will be at risk if we don't, take heed and start to kick into action now with what we can and know we have to do. So I don't know if that answers your question specifically, but that's some of our concerns.
Dr. Kavanaugh?
Yeah, I think it's important with two aspects. One is that we have some sort of universal care, that everybody can get care when they need it, especially when it comes to infectious disease. And two, we definitely need more federal control and regulation. For example, the CDC cannot enter a facility unless they're invited.
Wow.
They've been asking the CDC officials how many tests have been done in the United States and disparaging them if they don't know. Well, they don't know. It's done by all these independent little factions. That's the system we have. We do not have a centralized system. As far as Medicare for all, it's hard to know exactly what that is. Everybody has their different idea. Is that our traditional Medicare for all? Is that Medicare Advantage with insurance companies? Is that having a totally governmental system like the VA? Is it an opt-in Medicare where other people can still have the private system? There's so many permutations on that.
Well, the one that I would be saying is that basically it's a single-payer system where the government pays the bill as opposed to an insurance company, which wouldn't be necessary in, say, Sanders' plan and some others. That's what I would say, because therefore the government wouldn't be the doctors that are working for the government and controlling it. It'd be private doctors working, as they normally do right now. It's just that as opposed to the bill being paid by an insurance company, it's being paid by the government, and obviously the patients themselves are also paid into the system. I just think it would be a lot easier, and again, the other countries have done it.
It may be, but when you get into government-private partnerships without competition, without good transparency, which we don't have in our system, you can have significant problems with that too. It's not an easy fix.
Not a panacea. I hear you.
When you look at corruption and you look at greed and the ability to make money, and putting money over patients, it seems to be pretty independent of the type of payment system. You have to have a system that has very good checks and balances and transparency. So you have to devise a universal system that has that.
Yeah.
And so it's not an easy question. It's a campaign issue. And besides, that's different from the coronavirus. We just need to make sure everybody can get a test and everybody can get treated for this coronavirus, because anybody who can't can infect other people. That's what we need to be concentrating on now. We can worry about what we have to do to prevent this in the future come the November election. But right now, we need to concentrate on getting ourselves out of this mess, and we need to get away from divisive political discussions and getting more into a medical mode of how do we treat this, how do we get us through this predicament. Because I'm a firm believer, and I think the stock market has proved this, that you can't solve this with the Fed. It's not an economic problem like 2008.
No
it's
doubt
a medical problem.
It
has
is a
to
medical
be solved
problem.
medically.
And you got to get the right professionals. And you're right, folks. We'd run out of time. It's so great to have you on again, Christine. A pleasure to meet you, Dr. Kevin Kavanaugh, again, board president. Thank you very much, both of you, for your expertise and your time. We will do this again as needed. And again, folks, please understand that we need to work together on this. Go to Health Watch USA as well for more information. This is the Jeff Santos Show. We'll be back after this timeout. Thank you both.